One of the questions in doing colon cancer screening is if someone has a positive test, how long is the optimal time to be able to do the follow-up exam? Particularly for something like colorectal cancer screening after a fecal immunochemical test, a colonoscopy is a fairly big deal. People have to be able to take a bowel prep, they have to take time off from work. And from the standpoint of the healthcare system, it takes a while to be able to schedule that. It's a sedated procedure, has to be done inside of a particular endoscopy unit. So both of those things can take a little bit of time. So if there is some harm that comes from having to be able to wait for a while, then we want to be able to make sure that the time is as short as possible. On the other hand, if short periods of waiting are not harmful, that actually gives both the patient as well as the healthcare system some additional flexibility in terms of when to be able to schedule the time. So there was not a lot of information on how long is a safe period or whether or not if waiting certain periods of time increases the risk for doing the follow-up test. So that was the purpose of this study, was to see what would be relatively safe periods of time or when the risk starts to go up. So Kaiser Permanente in Northern California and Kaiser Permanente in Southern California are large integrated healthcare systems that cover about a third of the population in those regions of California. So in those systems, in order to be able to have the most proportion of people having colon cancer screening, a combination both of colonoscopy or FIT are given as choices. And for people who have not been screened, the FIT test is actually mailed out to them. So essentially this is everyone who's screening eligible who hasn't been screened by some other method, they're not up to date with screening, they would receive the FIT test in the mail. So it's really kind of like that whole population. And then among those people, those who have a FIT test which is positive, that's the group that we then looked at to be able to see what happened subsequently to them. And we made sure that they had enough follow-up time, and then we looked at what the results were of the colonoscopy and other tests that might have diagnosed colon polyps or colon cancer. The risk seemed of having a colon cancer, any colon cancer, so if you wait a little while, it's possible that a polyp might turn into a cancer, and if you have a cancer, it's possible it might go to a higher stage. So the two big questions we were looking at was the risk of having any cancer and then the risk of having an advanced stage cancer. And the risk of having any cancer didn't increase until people were at least about 6 months out in the 6 to 12 month time window, and went up substantially more if they had delayed by 12 months or longer. Now that seems like kind of a long time, but actually the average time to colonoscopy in a lot of parts of the United States or in other parts of the world can be several months. And a lot of people actually have not had an exam done by the time you get to a 6 month time window. Within this study, the vast majority of people within our system, because we actually have pretty aggressive methods of getting people in quickly, about 75% of the people had had their exams done within about 3 months. There were certain groups, like people who were a little bit older, so people in the 50 to 75 year age range, probably because they're at higher risk of cancer, they also seemed at a higher risk of delay. And so there was somewhat of a signal of the risk going up in that group for people who were in the 3 to 6 month time window. But that's the main findings, is that for the group as a whole, the risk of any cancer started going up at around 6 months, but there were certain groups where it started going up after 3 months. Well, if you're operating a FIT program or if you're talking with patients and they want to be able to know, can I wait a little while until after I have this exam done? I think the main message is it's probably okay to wait a little while, but I wouldn't really wait too long. And for guidelines or for groups that are putting together kind of large programs, probably the goal would be to be able to have people in no later than 6 months, but there may be some groups that may be at higher risk at 3 months. So those are a couple potential time goals to be able to say, well, let's try to be able to see if we can get everyone who needs to be able to have an exam done in by that period of time. One of the other things we looked at was also comorbidities. So there's a type of a score that you can give people. So if somebody has diabetes or they have other things, they get more points in this score. Interestingly, people who were the healthier ones were the ones who were seemed to be at higher risk. The people who had more points in this actually seemed to be at lower risk. We don't know exactly why that is, but there may be more false positives in the people who were not as healthy, maybe because they're taking blood thinning medications or other things that would be more likely for them to have the blood in the stool.